Hi there, my name's Dave Carrol. Welcome to the COVID-19 update special here for Brantford, Brant County and beyond. Obviously, boy, things are different than they were a few weeks ago, and we wanted to take a few minutes today and sit down with our Mayor, Kevin Davis, and talk about how this virus is affecting our community and hear what our city and our community is doing. So I want to welcome our Mayor, Kevin Davis, to my fake living room here. Thanks for coming, Kevin. I'm sure that this has been a very interesting week in your life.
It is. It's something I'll never forget. It's something that I think all of us will look back on and realize that this was a moment in our lives that where we changed.
A couple years ago, we had the issue with the flooding in the Grand River, and all of a sudden we were faced with a bit of an emergency as a city, kind of unlike we had seen before, and the city was faced to be able to go, all right, this is the procedure, we are executing this. There was a command central. As I'm sitting at home thinking, I wonder what the city does in a situation like this. So this hits, alarm bells sound. What does the city do? What is the first thing that the city does?
So let's talk about what happened during the flood. So we had an emergency declaration was made, and then it's called the EMO, the Emergency Measures Organization, representatives from various leadership institutions in the community. That got together and did all of the planning for our community. That will probably, I suspect, happen today. It's our medical officer of health, Dr. Bannicky, has to make the declaration, and then that EMO committee will form, and that will do the planning for our community. Now, we could see this coming. That's why the city set up what we call the Emergency Planning Committee that meets at 9 a.m. every morning. I sit on that committee as well. So we've been meeting for the last, I believe, about 10, 12 days, anticipating this was going to happen and knowing that we had to do the update, because we do have a pandemic plan. It's been there for a number of years. We've had various exercises in the past about it, but you got to update it for what you're currently facing. So that process began. It's I lose track of the time, but it's at least 10, 14 days ago. So what'll happen now is when we have the EMO committee, overseen and led by Dr. Bannicky, the Emergency Planning Committee meeting will continue, but at a lesser level.
As you walked into the studio, as we're talking right now, it is what's today? Today, boy, we're losing track of time. It's Tuesday morning. It's Tuesday morning at 10 o'clock. As you walked into the studio today, you said, this thing changes moment by moment. How does a city respond to something that the information changes moment by moment?
Well, you've got to be adaptable. And that's why we meet every morning. In fact, not only does our committee, the Emergency Planning Committee, meet every morning at 9, and we meet virtually, right? Oftentimes we're meeting again at the end of the day, because as you go through the day this week, there are various announcements from the federal and provincial government, and so you have to continually adapt your plan to the information that's coming to us from the public health professionals, the province, and the federal government.
Okay, so let's go high level. Where is our city when it comes to this as far as do we have confirmed cases at this point?
Well, the medical officer of health has to tell us that. That comes from the public health unit. And we know we have these 25 probable cases, all of which are relating to travel. People have been in Italy or Iran. There's some testing being done of those individuals. The health unit tells us that. And we should soon know whether or not any of those cases are lab confirmed, right? But I tell people, look, we're not going to escape this. If we don't already have COVID-19 in our community, we'll soon have it. And so, because we cannot construct a wall and prevent it coming into our community. So it's coming, it's either in our community now or it's coming in. And we can't measure precisely what's happening with 160,000 people and know exactly what it is. So I take the approach, if it isn't here, it's going to be here soon. So the plan for us locally is, how do we contain that so that we limit the spread of the virus from individual to individual within our community? That is the key element of the plan, because what you're doing is avoiding any spikes in the number of people you have with COVID-19 at any one time, because that spike puts pressure on the hospital. The idea is to either space it out and hopefully reduce some of the transmissions, but spacing it out means the system both city, essential services, the hospital can better adapt and handle.
Flattening the curve is a new term that you've heard quite a lot in the last couple of days.
We've heard a lot about it, and it makes a lot of sense, and our public health professionals are telling us that's the key to dealing with this successfully.
I think when I first heard that, I thought that is the best description that my mind, that's not, neither of us are medical professionals, that my mind was able to go, all right, I get it. I get why we have to be able to start separating ourselves from one another.
Other people have said to me, why are we doing this now until we have a lab confirmed case? And I say in response to that, you've got a storm coming. We know it's coming. And so you batten down the hatches. And if you're trying to batten down the hatches as the storm is on you, that's not very effective. You batten down the hatches in advance. And that's really what we're doing. And if we're doing it too soon, I say, well, I'd rather do it too soon than too late.
Brantford is not an island. We're a part of a very global community, aren't we?
Yeah, exactly. And so some of the things that we're doing, you notice I am carrying this. I carry this with me everywhere. Whenever I touch a surface, I wash my hands and I try and avoid touching my face because, and that in combination with the social distancing. And so people ask me, well, why is that? And that's because it seems, the evidence tells us it's spread by those who are infected through the droplets. The air they breathe, you give off these droplets.
Which is why we're sitting a good
we're
distance
sitting
apart.
6 feet apart because these droplets hit the ground. And if you walk into a field of droplets, that's how you can get the virus. And so that's the idea behind the 6 feet, that any droplets that you are exuding from your body, they hit the ground before they get to me. And I got to tell you, through the day, I'm maintaining that as strictly as I can. And when I see people that are getting too close, I tell them, look, move apart, please. And then what you do is, so the droplets that you exude will hit this table. And if I touch the table, well, then I want to make sure that I then clean my hands. That's why if you're touching surfaces through the community, that you're using the hand wash to, if you don't have it, you wash your hands. And then don't touch your face. Because you take the droplet from the table, and you touch your eye or your nose, your mouth, that's how it gets into your body. That's what the evidence seems to be telling us. So
the fact that I have to clean my glasses this many times in a day from fingerprints tells me that we touch our face a lot. I realize that even in this interview, I've touched my face. How do we, boy, it's not easy to be able to retrain yourself.
It's not easy. So that's the constant use of hand wash if you've got it. The other strategy is, well, just don't get out in the community unless you absolutely have to. And that's especially true for those who are 65 or over, and for those under 65 who have medical issues that affect their immunity system. So, why expose yourself unnecessarily since you're in the risk group, which actually, I guess I'm in that risk group, which is why I'm now doing a lot more from home and only getting out when it's absolutely necessary. So for those that are at some risk, they should be limiting, what they do in the community. And having other people in their family who are, the under 50s, very healthy, have them do the shopping for you and whatnot. But what's also interesting, we're seeing businesses now react to this because there's some businesses that have to stay open, that provide the necessaries of life and produce those goods. So example, Zehrs. Some of the grocery stores are now offering, go online and order and you can come in and pick it up. Other businesses, same kind of thing, call in your order, do it online and we'll come out to your car and deliver it. We're going to see more of that. And that's businesses realizing, well, we got to carry on because we're providing essential service, but how do we change what we do to better protect our customers? Another example is our transit system. So that's an essential service. It's important to move people around the community, especially in the industrial areas where companies are producing the goods we absolutely need. So we're actually doing blocking off rows so that when people get on the bus, they're forced into that 6-foot separation. On some roads, we're actually having to add buses because of that. So that's an example of the types of decisions businesses and individuals are making across the community to flatten the curve, limit the spread.
The adaptation part of this is very interesting because as you say, we're watching people try and figure out ways to be able to be responsible but still maintain a degree of normalcy in life as much as possible. What about the social aspect of this? So even at Freedom House, we're trying to figure out how do you help people get together but not get together? Obviously, social media I mean, this may be the most incredible usage of social media that has ever existed, right?
Right. Well, video conferencing, Skyping with your family and friends. We're going to do a lot more of that just because we have to maintain contact. We can't all live in isolation. It's important to our mental health that we have some contact with one another. And
you've been excellent at this, by the way, I'll say. I mean, even since you took office as mayor in communicating and using social media, you've done a terrific job of this. And so as I've watched, as this has rolled out, it's become people knew that they could go and hear from you in a crisis situation because you set that as a precedent. So.
Yeah, that's important. That's my role as mayor. And that's another message I give. And look, at times I've thought about this, and because I'm a bit vulnerable, I get scared. But then I say to myself, well, you can freeze yourself through panic and become totally useless to your family or friends. And so you have to deal with that and say to yourself, okay, calm down. Got a job to do. And you carry on. And that's like from World War II, stay calm and carry on. And I think we have to recognize this is hugely disruptive to people's lives, to businesses, to people's ability to earn a living and putting food on their table. The challenge is enormous. And, I took a lot of comfort yesterday in the provincial and federal government saying, look, we're going to be there to support families and individuals who are going to take an economic hit off this. And that's important because that causes a lot of anxiety as well. And so, example, the city, I'm asking council to consider what we do with the next property tax installment, potentially waiving interest for a certain period of time. So I'm hoping at our council meeting next week, which will maintain all the 6-foot separation, that we'll consider that issue, our little bit, what we can do from the city.
Well, we are going to take a break in just a minute. This is the COVID-19 update show for Brantford, Brant County. We're here with Mayor Kevin Davis, and we've chatted about some of the different elements. I want to talk a little bit about coming up after the break about where you can be tested, how you can be tested, what you should be looking at, what's the sniffles, and what is something that we should be. And again, we're learning as we go here, but it's wonderful to be able to have you here and to be able to chat about this stuff as a community. It's super important. So we'll be right back right here on Rogers TV right after this.
Your career is too important to just leave to chance. In order to move it to where you want to go, it's going to take some big decisions and some leaps of faith. Allow Rogers TV and the C-Suite to help you navigate your career to where you want to go. We will be sharing career tips, tricks, and ideas and experts that will help you to understand what it is that you want and how to get there. So at the end of the day, you are landing in your C or choice suite.
I'm Carrol from Generation Z, here to talk about all things important to my generation. We'll talk about politics, healthy living, education, and all things important. Join me at 7:30 p.m. on Saturdays for Generation Z.
Hyperlocal news focused on what's happening in your community, your region this week. All local, all year round. Fridays at 7 p.m. right here on Rogers TV.
At a time when technology was transforming the world around us, Ted Rogers was creating a better television experience for Canadians.
There was no cable. We created it the hard way. We built it.
With the launch of Rogers Cable, he united us all to laugh, to cheer, and to witness the world around us. 60 years ago, Ted Rogers started our company to connect Canadians to the people, places, and things that matter most, and to make more possible for all of us.
You can make more.
Hey, welcome back to the COVID-19 update show. My name's Dave Carrol. Great to have you here. Boy, it's a different situation in our communities than it's been maybe ever in our lifetimes. This is a very unique time, and I'm joined by Mayor Kevin Davis, who you walked into the studio today, and I said, "So, what's new?" And I imagine this has been. Well, actually, let me ask you what does it feel like to be able to be at the helm of something like this? Is it a strange feeling?
Well, it's not entirely strange, because as you go through the entire years that I've been mayor so far, there's been lots of instances where you have to, step up and make decisions and exercise some leadership. And in some ways, when you're in these situations, you expect your leaders to respond appropriately and provide leadership. And that's what I always tell myself. No matter how we feel about this personally, we each have our own roles to play. And it's very important to me. A sense of duty and commitment to my community is very important to me. And I always hearken back to that if I'm feeling a little anxious, that I have my duty and my duties, and I want to execute and perform them because I'm very concerned about my community and the health of the residents of our community, and it's important for me that I do that. And so I try not to think too much about how it affects me emotionally. It's just hunker down, carry on. Awesome. That's my modus operandi.
Okay, so let's talk about City Council. Obviously, City Council weekly deals with all sorts of different important issues in the city, and I imagine this has certainly dominated discussion over the last little while. How does City Council function in a situation like this, and is there regular city business that is still being done while dealing with the response to this?
Yeah, there are certain decisions that have to be made by council, so we will have to meet. Unfortunately, the Municipal Act, it's strange. It allows us to have a virtual meeting that people can connect in, councillors by computer, and they can vote, but they don't count as part of the quorum. And you need 6 people, so we have to have at least 6 people present to have a council meeting. And our next one's coming up on Tuesday. So working with staff, we're trying to figure out how we can do that in the council chamber. If there's 6, 7, 8, 9, 10, 11 councillors, how do we set it up so that everybody's at least 6 feet apart? And tons of hand sanitizer, and limiting the number of staff that come into only those that we absolutely need, and probably discouraging people, the delegations coming in from the public, because we'd have to protect them as well and make sure they're all standing apart. But I don't think we're going to have that, because we're changing the agenda items just to the essentials. What is it we've got to make decisions on, and everything else, just postpone it. And I would prefer we not have more than 1 meeting per month. So we're going to combine committee of the whole and council. We haven't made a final decision on this, but I think that's what we're going to do, and limit the issues to just the must-dos.
Because it's different times, so it calls for different decorum, I guess. So let's talk about people at home. So people are watching this in their living rooms or online, and they have the sniffles. How do they know what's the sniffles and what is get me to the BGH?
Well, so you go to the Brant County Health Unit website. That is the best source of information. And they have a hotline. They have an email hotline. And if you have any questions, you definitely need to speak to the experts, which is the Public Health Unit, Health Ontario. And they've had some issues with their lines, but they're sorting that out. For example, the number of staff at the health unit that now man the line, it's incredible, the number of people within the unit that are manning the helplines. And that's an example of an organization responding appropriately to whatever it is the demand that's on them. So definitely have to go to the Brant County Health Unit website to get those answers. There's also self-assessment tools the Ontario government has set up online. Part of the issue has been that we haven't had enough testing kits. That's nationwide. And so we're not in a position where if anybody has a sniffle, they get a test. I mean, we may get to that point as the supplies increase, because that's a focus of the federal and provincial governments to increase the supply of testing kits. And we're also looking at, the hospital has a sort of kind of standalone assessment center they've set up to keep the load off the emergency department. They've asked us.
And that's
city,
at BGH.
That's at BGH.
Okay.
But again, the first point of contact, if you have those questions, go to the Brant County Health Unit website. Some of the things we're doing, they've asked us, the hospital and the Brant County Health Unit, if a city facility like the Civic Center could become a testing center if the supplies become available. And so we're already looking at that. So that's a possibility. Again, all dependent upon the testing supplies available through the province. But that changes day to day as well.
We should point out, because this is something that people may see at different times right now. It's Tuesday morning at 11:30.
Yes.
And so you may see this later and go, well, that's old news, but this is something that is moving.
So we had the announcement this morning by the Premier that we're a state of emergency province-wide. And then for example, how quickly it changes. I have a telephone conference call this afternoon with the Minister of Health and the Minister of community. Sorry,
another minister.
Steve Clark. The name is Casey. But anyways, so and then I'm going to get information this afternoon, and then I convey it to the emergency planning committee. So it constantly changes. It's changing by the hour.
Okay, let's talk a bit about caring for one another in a community, because I mean, this is the heart and soul of a community, is how our citizens interact with each other. That's what makes living worth it, right? So how can we care for our neighbors in this time? What's the best way to care for each other?
Yeah, and that's going to be important, because we can rely upon our governments to meet a lot of our needs, but the governments can't do everything, right? And we need the help of citizens. And I think it's as simple as on your street. You know your neighbors. I think you can figure out, and you'll know who it is that may be self-isolating, or let's say they're in that risk category. And ask yourself, what can I do if you're not in the risk category? What can I do to help them? Maybe it's walking their dog. Maybe it's getting groceries for them if they need it. Maybe it's going to the drugstore and getting whatever it is. So you look at what's on your street, look at your family, look at your friends, figure out whether you're at risk, right? And if you aren't, then reaching out and helping those people. Again, all the while, hand sanitizer, maintaining the 6-foot separation distance. But there are going to be some people in our community, especially the elderly at risk, that have to stay within their homes, and they're going to need some help, either from their family or friends. And so we're going to have to help one another.
It's
always bearing in mind
but
the risk
really
factor.
Now it's extra important, right? Because this can begin to play on your mind.
Yeah, it can. But more importantly, as I tell people, we're going to get through this. There's going to be an end to this, but it's going to get a lot worse before it gets better. And we're going to get through this. The only way we get through this is by all of us working together and helping out where we can, all the while being mindful of what we have to do to protect our own safety and that of our families. And I'm confident we're going to do that.
Yes.
Because and I know, we have a tremendous sense in our community of volunteerism.
Yes. People
want to help out. And I think we have much more of that in our community than we see in other communities.
Yeah, I think it absolutely is true. You play these scenarios through, this is something that is an area of passion for mine, as you know.
I know it is.
Right?
Yeah.
So you play these scenarios through and you think, how is a community set up to be able to do this? Can we mobilize people? And it'll be very interesting to see how creative people get with these things. Well, one of the things I was asking you is about being outside. A self-isolation and that sort of thing is certainly extremely important, but it's okay to be outside, isn't it? And
it's important because that's part of being healthy.
Yes.
So, for example, on Sunday I went for a walk. I live near Mohawk Park. I walked through Mohawk Park with my dogs. Beautiful. It made me feel better. But there were groups of people, and I did make an effort to walk around them. You got to maintain this 6-foot social distancing. But it doesn't mean you just hunker down in your basement and don't do anything outside your house. You need to get out.
That's where Fortnite is for teenagers.
Fresh air is good for us.
It's
good for our health. But at the same time, if you're getting out, like walking is probably a good thing to do. But be careful. Don't be touching surfaces. And maintain the distance.
With our Prime Minister, who has been self-isolating for his first press conference, it was outside, and I thought that is a very astute way to be able to communicate that we don't have to go into a bunker.
Right.
We can be outside.
But they're tough decisions, and I'll tell you something personally. So I have a family that lives in the Yukon, 2 grandsons that I haven't seen in 7 months, and they're here in this week very shortly for 2 days, and so. I told my daughter, I want to see my grandsons, right? But I can't hug them. So that's where you got to make those tough decisions in that situation. So I had them, they gave me a leg hug. below my knee. And I patted them on the head, and otherwise, maintain the distance and wash my hands. But that's just a small little example of, the difficult decision we make within our own families. It's tough, but hey, we're going to get through it. If we make the right decisions as we go through our day to limit our exposure and helping others who need our help.
We have a couple minutes left. What's next? Like, what's next for your, all right, now we're going to go and tackle this. Is it are there goals and plans where you go, all right, in the next day or two, we have to be able to reach this, or is this now we're doing what we can, the information's coming, and we're going to react to the information that is brought down? What's next?
It's both. So every day, new information comes to us, usually from the federal and provincial governments or the public health authorities. So you got to react to that. You got to be nimble. But at the same time, you have certain priorities. So for us at the city this week, it's been how do we provide the essential services to protect staff and protect customers who need that service. That's example like the bus system. Another big issue for us and priority is, of course, our homeless shelter system. And how are we going to, right now there's nobody that's showing any symptoms, but how do we take someone and isolate them within that system? And the operators are already doing a number of different procedures to maintain the safety of the residents. And part of it is that meals issue. So that's a big issue for us this week to figure that out. There's a whole host of issues that we deal with every morning. Yeah. And every day it does change, but yes, we do have some, let's call them overarching priorities that we deal with, but those also change from day to day. Well,
the food bank is still open.
Yes.
I think it's such an important thing to be able to remember to care for each other and think about how this ripples. And you guys are doing a wonderful job. And I'm thankful that you took the time to be able to come and sit 2 meters away from me and have a good chat.
I've said it many times, but think about it as you go through the day. How do I change if you have to get out, how do I change my day to protect myself?
Yeah.
Right?
Yep. And we will get through this.
We'll get through it.
We will get through this.
We'll get through it.
Mayor
I don't
Davis,
have any doubt about that.
Thanks so much for joining me today. And thanks for watching the COVID-19 update show here on Rogers TV. We will do our best to be able to keep you informed here on Rogers TV as we go through and make sure that you are following the safety procedures, make sure that you are keeping distance from one another, but don't forget to connect with each other. That's what community is all about. Take care. Bye-bye.